One. Hello, my name is Rance Pascual, and today I'll be talking about the effect of nutrition on older adult health. And today I will be exploring malnutrition and gut microbiota in older adults. So first, I'll be talking about malnutrition, and Malnutrition Awareness Week is September 16th to 20th. And the Older American Act, OAA, Nutrition Services aim to reduce hunger, food insecurity, and malnutrition, promote socialization, and promote the health and well-being of older adults. ACL's Senior Nutrition Program funds local providers who serve home-delivered and conjugate meals in the communities across the country. These balanced meals meet the science-based recommendations for nutrients needed by older adults as they age. Meals are often tailored to meet cultural and dietary preferences. The OAA funded nutrition services also screen for malnutrition, deliver nutrition education, and nutrition counseling, and connect older adults to support services and evidence-based health promotion programs that help them maintain their overall health and independence. As you see on the screen, malnutrition is the highest in older adults, as from ages 65 to 85, they have the highest two rates. And 32% of seniors living in community or residential care are malnourished. Next, I'll be talking about aging, as aging is a universal and complex process affecting all organisms, and over time, aging brings about physical, biochemical, and metabolic shifts in the human body. In the news article exploring the role of gut microbes in the aging process, this article delves into the dynamic interplay between the gut microbiome and aging. One significant yet understudied factor in this process is the gut microbiome, which is a diverse microbial community that profoundly influences health. In older adults, there is often a reduction in microbial diversity, which is a less diverse microbiome and is associated with frailty and a higher risk of age-related diseases. When the composition of the gut microbiome changes, an increase in frailty-associated microbes increase and a decrease in good gut microbes and beneficial short-chain fatty acid producers decrease. This shift can impact metabolic processes and immune function, making older adults more susceptible to illnesses. A microbial imbalance can lead to increased gut permeability, often referred to as leaky gut, and this condition allows harmful substances to enter the bloodstream, which potentially triggers chronic inflammation and contributes to age-related diseases. The changes in the gut microbiome are related to inflammation that accelerates aging and is associated with various age-related conditions, including cognitive diseases such as Alzheimer's and Parkinson's, and cardiovascular diseases and type 2 diabetes, diabetes. And this can disrupt metabolic processes leading to conditions such as obesity and insulin resistance. Now now let's get a closer look into the study uh, that's titled Aging and Aging Related Diseases from Molecular Mechanism to Intervention and Treatments. And this study mainly talks about the role of gut microbiota. And gut microbiota increases digestive health, immune system regulation, metabolic health, cognitive function, and longevity. Gut microbiota can influence how individuals respond to dietary changes and nutritional interventions. For example, certain diets can promote the growth of beneficial bacteria, which in turn can enhance metabolic health and reduce inflammation. And as you see on the slide, gut microbiome increase digestive health, immune system regulation, metabolic health, cognitive function, and longevity. Now I'll be talking about nutritional intervention and nutritional interventions such as implementing the Mediterranean diet, which have been shown to positively influence gut microbiota composition. Diets rich in fruits, veggies, and whole grains and healthy fats promote the growth of beneficial bacteria, which can enhance metabolic health and reduce inflammation. Uh, Nutritional interventions, including the use of probiotics and prebiotics, can positively influence the gut microbiome, which plays a crucial role in metabolic health, immune function, and even mental health. The production of short-chain fatty acids from dietary fibers, which have anti-inflammatory properties and support gut barrier integrity, is one way how gut microbiota positively affects health. The findings suggest that these interventions targeting gut microbiota, such as probiotics and dietary modifications, could serve as a therapeutic strategies for preventing or managing various diseases, including cognitive disorders and metabolic syndrome. Now I'll be talking about another study, and this study is about probiotics. And in the article, Gut Microbiome Medical Mechanics and Age-Related Diseases, numerous clinical studies have demonstrated that probiotics can effectively reduce inflammation markers associated with aging. For instance, probiotics have been shown to lower levels of pro-inflammatory cytokines such as IL-6 and C-reactive protein in elderly populations, indicating a reduction in chronic low-grade inflammation. Research indicates that probiotics can enhance immune responses in older adults, and they increase the number of immune cells that respond to acute antigen exposure, which is crucial for maintaining immune competence in the elderly. Probiotics have been shown to improve gut barrier function and restore a healthy balance of the gut microbiota. This is due to the probiotics influence gut health in the elderly. Probiotics help restore a balanced composition of gut microbiota by increasing the abundance of beneficial bacteria such as lactobacilli. This balance is crucial for maintaining gut health. Now let's talk about the foods. The difference between prebiotic and probiotic foods are that prebiotic are foods that are beneficial for that feed the beneficial bacteria in your gut, while probiotic kind of like encourage the growth of more beneficial bacteria in your gut. And prebiotic foods and prebiotics are found in a variety of high fiber grains, vegetables, and fruits, such as garlic, onions, bananas, artichokes, soybeans, asparagus, and wheat and whole grain products such as bread and cereal. Now let's take a look at a systematic review. And in addition to probiotics, a diet that is high in protein is also good. And in the article, Nutrition Frailty, Opportunities for Prevention and Treatment, which is a systematic review, the article discusses the role of macronutrients in the context of nutrition and frailty, as it emphasizes the importance of a balanced diet and the overall dietary patterns that may influence a frailty risk. So, as you know, eating a lot of protein is good, but that's not enough to help with frailty. So the combination of protein supplements, including amino acids and enriched protein supplements, along with exercise training, resulted in greater improvements in outcomes such as lean body mass, hand grip strength, and leg strength compared to exercise training alone. Now, how does this connect to the class? Frailty could lead to falls. Poor nutrition could lead to higher risk of frailty, could lead to higher risk of falls. And one of the factors affecting falls in older adults is poor nutrition. Older adults need protein, calcium, and vitamin D. And and without without a proper nutrition, older adults can develop diabetes, which could over time evolve to elevated glucose levels and over time cause blindness and hard of hearing, which increases frailty and risk of falls. And in another article, nutrition and physical activity and the prevention and treatment of sarcopenia. Sarcopenia is a loss of muscle tissue as a natural part of the aging process. The loss of muscle could increase the risk of falls, so having proper nutrition and exercise increase health and longevity. Um, Nutritional interventions can help identify and address malnutrition, which is a significant risk for frailty. Nutritional interventions can focus on increasing the intake of certain nutrients that are crucial for maintaining muscle mass and strength, such as protein, vitamins, B and D, and minerals such as calcium. Studies indicate that older adults with higher protein consumption have better physical function and lower odds of developing frailty. In addition to protein, carbohydrates are a primary energy source for the body, which is important for maintaining physical activity levels and adequate energy intake in older adults. The article highlights the role of healthy fats, particularly those found in Mediterranean diets, such as monounsaturated fats from olive oil and omega-3 fatty acids from fish. And these fats have anti-inflammatory properties that may contribute to better overall health and reduce frailty risk. So tying it all together, a balanced diet rich in fruits, vegetables, whole grains, and fiber can support a diverse and healthy gut microbiome. Foods high in prebiotics such as garlic, onions, and bananas, and probiotics such as yogurt and fermented foods can enhance microbial diversity and function. Certain probiotic strains, such as lactobacillus, have been linked to improve immune function and reduce inflammation in older adults. Prebiotic promotes the growth of beneficial gut bacteria and can help improve gut health. Prebiotic fibers can enhance the production of short-chain fatty acids, which are beneficial for metabolic health and immune function. Regular physical activity has been shown to positively influence the gut microbiome, as exercise can promote microbial diversity and enhance the overall health of the gut microbiome, contributing to a better metabolic and immune health. By implementing these interventions, it may be possible to modulate the gut microbiome, reduce the risk of age-related diseases, frailty, and promote healthy aging. And thank you. And these are my sources.